Good morning, everybody, or good afternoon, good evening, wherever you are in the world. Welcome to the fortnightly webinar, and it's wonderful to have you with us today. So I'm sure some of you know who I am, and I'm Tracy Collins. I'm the International Nursing Workforce Lead for the Devon International Recruitment Hub. And we have Laura on the call as well, who I'm sure lots of you have met and have been communicating with Laura over the last sort of few weeks and months. And we have Tracy Arscott with us today, who is the Senior Sister for Patient Safety and Quality in the Emergency Department, so A&E at Torbay and South Devon. So Tracy is going to give you a little presentation and talk to you around how it is to work in the emergency department in Torbay and South Devon. And we will then be followed by Jane Dorothy, who is one of our OSCE trainers and clinical facilitators in the clinical education department, who will also talk to you about opportunities to come and work at the Royal Devon and Exeter Hospital. So very exciting morning, and we hope you'll enjoy. And I'm going to hand over to Tracy and hear all about the emergency department in Torbay and South Devon. So welcome, Tracy, and I'm going to hand over to yourself. Thank you.
Thank you, Tracy. I hope you can all hear me okay. My name's obviously Tracy and not James, as it says on the slides. I have been asked to step in for James, who's our unit matron. And I'm going to be talking to you a little bit about working at Torbay and South Devon Emergency Department. So just to start with, just a little bit of background. We see approximately 156,000 patients per year. That breaks down to about 13,000 per month, 200 to 250 patients per day. So you can quite imagine that our emergency department is very, very full a lot of the time. So our emergency department is made up of a workforce of approximately 250 strong nurses and doctors, and then on top of that we've got support staff, domestics, administration, and included in all of that, all of those nurses and doctors, we have many overseas nurses that we've managed to recruit over the last few years. The department is split up into different areas, as all emergency departments over the UK are. We've got resus, we've got majors, minors, we've got the blue area, which is obviously our COVID pandemic area. Escalation, triage, and the waiting room. We've got a clinical decisions unit, and we've got a dedicated paediatric area also. As part of our resuscitation changes since the pandemic, we've obviously had to make arrangements for our aerosol generated procedures. So we've now got a specific dedicated room for any patients that are needing assisting with their breathing and intubations. Can I have the next slide, please, Laura? Sorry. Thank you. So what are we most proud of? I think I've worked in the department for about 16 years in many different guises. I've worked as a junior band 5 nurse up to a band 7 nurse. And I've also worked in the practice education role as well. And I think probably the thing that I'm most proud of over the last year or so is how admirably the department team have risen to all of the challenges that have been thrown at us, having to change on a daily basis with our processes and managing to provide compassionate care to our patients in a very stressed environment. And although our department is often at that overwhelmed state, we get weekly commendations from relatives and patients saying how amazing that they've found the care and treatment that they've been provided with. So I think that's that's what we all come into nursing and healthcare to do, is to provide the best care for our patients at in the best possible time. Can I next slide, please? Brilliant. So I have just taken on the role of a quality improvement, quality and safety for the department, which is a super new role, looking at the quality and safety over the entire department, and to see how we can improve that. Over the last year or so, or over the last couple of years, we have, sorry, oops, my computer's just decided to go a little bit slow. We have had the introduction of a supernumerary band 7 role on each shift, looking at the quality and safety and supporting our nursing teams in delivering that care. Often we have to prioritise care, and sometimes it's nice to have that senior nurse to come around and support our junior nurses in prioritising what can be sometimes very difficult decisions, and knowing that we've got the support and the guidance of those senior nurses has been great for our team. We have weekly multidisciplinary governance meetings where we look at any incidents and learning from those incidents, but also looking at how we can provide assurance going forward and how we're going to make changes to reduce the risk in future. We've implemented new delirium screening tools. We have increased our numbers of departmental paracentesis for bacterial peritonitis testing, early identification of high falls risk patients, and this is the way our department is. We often can't see all of our patients all of the time because of the geographics. So we've looked at enhanced cubicle allocation for these patients, as well as falls mats and alarms and things like that we've managed to introduce into the nursing care. Adult nurses coming to the department get a 4-week supernumerary period when they're new, and then going forward, what we try and do, because we've got a dedicated paediatric team and a dedicated paediatric area, we actually encourage our nurses to have a 4-week supernumerary period, often after about a year of being here, but we're just trying to get all of our current nurses through that to work in the paediatric department and alongside our experienced paediatric nurses to enhance their skills in paediatric care. HCA training program to enhance the paediatric care for healthcare assistants also, which again is a new introduction, which is being really well received. We have done enhanced waiting room safety and support for observation and assessment, and this is because we have in recent months had longer waits within the ED, so we need to make sure that each and every area, including those patients that are still waiting to be seen, are safe and observed. We've also introduced tools to help with that. So we've got a prompt tool, the ED safety checklist, and other innovations have been implemented. We've actually implemented quite a lot over the last year. It's possible for me to talk about all of those. If we can go on to the next slide, please. One of the things that we absolutely pride ourselves on is our internal development and training, and I think this is important to talk about. So we have, on top of the supernumerary time for new nurses to the department, we have in-house immediate trauma life support. All of our band 7s are now advanced life support practitioners. We have lead minors practitioners and emergency nurse practitioners running our minor injuries area. We have new middle grade and doctor-led teaching, which is done on a monthly basis, and that's delivered over so to encourage as many people as possible to attend. We have all of our band 7s are either undertaking or have completed their master's level education in either advanced practice or leadership. Continuing daily turbo teachers, which is often a difficult one to get in, but we absolutely try our hardest to make sure that those turbo teachers happen. We've got a dedicated practice education team within the emergency department, which again is a great support for our internal development and training of our staff. We have minors and triage study days that run independently with that people can attend on a number of occasions if they need to, if they want to just improve on their skills in those areas. Our appraisal compliance has increased a lot since we have split our teams into each of our band 7s have got they're responsible for a group of our staff, because obviously you can imagine trying to keep up to speed with all of those 250 appraisals is quite time consuming, but it's really, really important for each and every one of our staff to understand that it's about their development and what they can bring to our team as well. We fully recruited, like I said, the practice education team. We have 3 in that team now, and they are doing an excellent job at delivering our ongoing development and education programmes within the department. And I've just put, James has just popped in there, not forgetting our Daisy award-winning teams. So we've had a number of our staff that have been nominated and have been lucky enough to have been selected to receive the Daisy Award. And next slide, please, Laura. Thank you. So recruitment and retention. Over the last year, due to the changes in the department and the changes in the geographics of our department, and also the acuity and numbers of our patients, we have had an increased nursing establishment, of which we are continuing to recruit and into those posts. What that does is it actually improves our, once we get those nurses in the department, and with our ongoing internal development and education, we've had a number of our overseas nurses and our British nurses actually developing through the bandings and becoming senior nurses in the department, which is absolutely fantastic. So really good career development. We have 2 new full-time consultants appointed, which is taking our consultants to, I think, possibly about 12 or 13, maybe 14 consultants now working in the clinical area. Administration teams and apprenticeships and completion of the NVQs and diplomas, and that's actually across the board. So we've had a number of our healthcare assistants actually go through their education and training by various different routes, and actually becoming band 5 qualified nurses also. Next slide, please. We have, as a trust, taken on the Pathway to Excellence and programme, which helps to create a bottom-up approach. And in doing that, what we've done is we've introduced the People's Council and the Patient Safety Council as part of our Pathway to Excellence. And what that does is it gets the people and the workforce that are working in the clinical environment actually suggesting and putting changes into place to make their lives easier, which in fact actually directly correlates to improved patient care, patient satisfaction and quality of care that we're providing to our patients, as well as looking after the staff and making sure that their well-being is looked after, and that they feel like they're actually making those improvements themselves and being heard, which is really, really important for job satisfaction. I think I've probably talked enough and given lots of information. So if there's any questions, I'd be happy to field any questions now.
Lovely, thank you, and apologies for being late. So I'm Carly and I'm the pastoral lead for the Devon IR Hub. Tracy, thank you so much for stepping in. Teams issues at the ultimate time, isn't it? Always the way. But no, but Tracy, really enjoyed listening to your presentation, and what an inspirational team and an award-winning team as well. That just sounds incredible. So I just wondered if you might just be able to sort of talk through a typical process and journey for an international nurse that might be coming to the department.
Okay, so we're our international nurses come into the department. They are buddied up with, obviously they have their overseas team looking after them as well, but they're buddied up with a band 7 clinical nurse who oversees them, and then they are actually buddied up alongside in a supernumerary capacity working in the clinical area. We work with them from the absolute basics, making sure that they've got all the tools that they need to be able to deliver that care, and actually being in the environment, having the support and making sure that they've got everything that they need actually encourages them to develop in their own way. We have competency documents that they work through, which basically breaks down every single thing into very small minutiae of detail, so that it's very clear what the expectations are of them. And I say of the overseas nurses, but actually all of our nurses that come into the department have exactly the same support and guidance, so that we're ensuring that our standards of care are absolutely paramount.
No, absolutely, and it sounds like you've got a very robust process in place. So for an international nurse that's arrived to work in your department, obviously they have to go through the OSCE process, and then at what point would they then go on to your preceptorship course?
They go onto the preceptorship course as when they've passed their OSCEs, I believe. Please correct me if I'm wrong on this. Correct. Actually, yeah, that's right. When they've passed their OSCEs, so they work in a supernumerary capacity until they've passed their OSCEs, and then the preceptorship course is run by our education team down in our Horizon Centre, which is a dedicated education centre which is on site at the hospital, with great facilities, and they will then work through a programme of education, again to build on what they've learned through their through getting to their OSCEs, and also through what they've learned in the clinical environment, so to really tie up the education, the underpinning knowledge and the clinical experience.
Brilliant. And so once, obviously you've talked through all of the sort of career development opportunities that the ED nurses have. So roughly, would you say at what stage might those opportunities be available to them? Obviously, bearing in mind they have to get their PIN first, then they do their preceptorship course. At sort of what point down the line would they then start to look at that further development that you've talked about?
Do you mean the further development as in the kind of the education in-house trainings, or do you mean the development from band 5s to band 6s?
Yeah, so that's sort of as they start to look at sort of senior positions within the organisation, and then they start to look at maybe masters programs that you've talked about. What would be a sort of a common point where people would start to look for those senior positions?
I think, without being sitting too much on the fence, I think that very much depends on the individual. We've had nurses that have come from overseas with amazing experience, because obviously prior knowledge and experience is a key factor in this. We've had some nurses that have come over that have been very, very junior, some that have brought years of experience. So I think it's, to put a time limit on it is very difficult. However, that said, if they are recognised as, being being excellent in their care, in their treatments, in their management style, in their leadership style, in all of those aspects, then actually, they will, each and every individual would be considered for moving forward, and developing their career. So I think, you know, the opportunities are there, and if people certainly want to do that, then they will be supported in progressing.
Absolutely, and that's a conversation we have quite often with our nurses that are onboarding, and many of which will be watching the webinar now, is that, you know, a lot of them bring over significant experience, you know, and the opportunities will be there for them to progress and develop. And we're just currently having conversations about leadership programs for this group of staff, you know, further down the line. But I guess, you know, as nurses, we've lived and worked through COVID, haven't we, for the last 18 months, and no one more than the ED department. And, you know, the pressures are very real at the moment, aren't they?
Absolutely, absolutely. I mean, currently, I think we have got three of our overseas nurses that have been here just over 2 years, I think, or maybe 3 years now, because COVID's hit in between. It's got a bit lost. But you know, that are in band 6 roles and doing absolutely brilliantly. So, you know, the opportunities are absolutely there and absolutely very real.
Yeah, no, definitely. And I think, I don't know about you, but, you know, sort of since the pandemic, I really feel that the NHS are really focusing on looking after staff well-being. And they really recognise that, you know, staff might be tired, and that's a priority now, looking after staff health and well-being. And I'm just wondering if you have anything like that down in your ED department for your team.
Yes, absolutely, we do. We have a wellbeing team that are within the department, that are parts of each part of the team. So we've got some healthcare assistants, we've got the wellbeing buddies. So we've got some healthcare assistants and band 5s, band 6s, band 7s, doctors, junior doctors, consultants, all of those people that are part of that wellbeing buddy team. And the trust itself has another overarching wellbeing team. We have support through occupational health. We've got coaching available for staff, and that's available to all staff. And the coaching is available to people from a self-referral. So that's, you know, it's easily accessed by individuals if they so wish to access.
So the wellbeing buddy, that sounds great. What a great idea. And obviously that's something that will be accessible to our international nurses coming into the department. And I think there's a recognition now that there's a real importance of having that time to reflect and discuss with colleagues.
Absolutely. One of the other things that has been set up, I just mentioned it on that last slide, was the People's Council, and that's very much looking at staff. And, you know, just to mention a couple of things that are coming up, they're starting to organise kind of walks, so monthly walks or 2 monthly walks, where people can just come and join up as a group, and actually it's out in a non-threatening environment. You can talk about work, but you don't have to. You can just go out and just enjoy the outdoors and things like that. So we're trying to bring that in for people, and obviously it's not mandatory, but the opportunity is there. And, you know, part of the People's Council, there are senior nurses on that as well. So it's about, you know, really providing that support for our staff and looking after their well-being.
And I think that's one of the things for us fortunate enough to live in Devon, is that, you know, we have got these things nearby, haven't we? So after a stressful shift, you know, the beach and the countryside and these things that really help us relax are very accessible.
Absolutely.
And I think that's one of the absolute pleasures of living in this part of the world. And one of the things we say to our nurses thinking of joining us is, you know, you can be on the beach within 10-15 minutes of most of our hospitals. You know, and that's so important, isn't it, for having that work-life balance?
Yeah, absolutely.
So we've just had a couple of general questions in the chat about OSCE training. So obviously all of our hospitals in Devon provide that educational OSCE programme. And I know at Torbay, in the main, you send your international nurses to Exeter. So we can pick up that question, that's fine. I didn't know, have I missed any other questions, Laura? No? No, that's fine.
Sorry, I'm on mute. No other questions.
Tracy, wonderful. Thank you very much indeed. It's been great having you on board.
You're welcome.
Thank you so much, Tracy.
Really good.
Thank you.
And
So
I envisage a lot of interest in the ED department in Torbay following this webinar.
Thank you very much.
You're welcome.
Be glad to hear
Thanks,
from
Tracy.
people.
Thanks,
Thank
Tracy.
you.
Bye.
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 Just
Okay.
waiting for Jane to join now. So Jane will be with us in a minute.
So we've got a jam-packed timetable this morning, and here is lovely Jane on cue. So I've got great pleasure in introducing Jane Dorothy, who's the right. Apologies if I get this wrong, Jane. You're the head of professional practice. No, you're the head of learning and development at the Royal Devon and Exeter.
Wow, that is a significant promotion. I'm the practice education team lead at the RD&E.
There you go. Yeah, Jane's the oracle, okay, guys? So all of you watching, Jane's the go-to girl in terms of learning, development, education, support and everything. So Jane's kindly come along today to talk about the opportunities for international nurses joining the Royal Devon and Exeter. So Jane, I'll hand over to you if that's okay. And people are going to be asking questions in the chat box and we'll ask them at the end. Is that all right?
Absolutely. I've got a little presentation that I'll bring up as well. So obviously I can't see the chat box at the same time.
That's fine. I'll keep an eye.
Good. It's a short and sweet presentation for everybody. So yep, hello, I am Jane Dorothy, has been forementioned. Let me see if I can work my technology. That's always a good start. Right. Are you able to see the full presentation, or are you just looking at the PowerPoint template?
Just a PowerPoint at the moment.
Yeah, I knew that would be the case. Let's try again. Right, how's that looking?
Yeah. It's not. Oh, yeah, that's better.
Look at that. I knew we'd get there in the end. Right, so this, as I say, is quite short and sweet for everybody. So Royal Devon and Exeter Hospital, some of you have probably been to talks from some of our other trusts in the southwest of England as well, such as Plymouth, Torbay, North Devon District. So although we are very tiny on the map, I do need to remind everybody that actually it's quite a distance. So if you are coming over with friends and wanting to be in a social group, then it's very sensible to choose one of the main trusts that you're all coming to. I would like to try and poach you all for the RD&E, but you know, I'll be realistic.
Yeah, come on now.
So I'm being realistic. If some of you have already got friends that are going to Plymouth, for example, it would be sensible for you to be looking at the same host trust, just because locality, travel and everything, it's a lot bigger than you think it is when you actually get here. So the Royal Devon and Exeter itself was actually founded in 1743 with 2 patients. Can't imagine what that was like. And then they had a 30-bed hospital, slightly different now. We employ over 11,000 clinical staff and we've got over 350 inpatients. So we've got day case units, outpatient services, we have maternity services, and we also go out into the community. We've got community inpatient hospitals as well as caring for patients in their own home, which is something with the NHS we are promoting more and more and more. So we really do want to try and encourage as many staff as possible to take up that opportunity of community nursing as well. We have your standard theatres, radiology, oncology, the same as you would expect in any large acute trust. So that's the boring bit about the RD&E done. At the end of the day, if you're coming to a big hospital, you'll see it on induction, you'll see it when you get here. There's some other information that you're more likely going to want to know from me. When you arrive in the UK, at present, obviously we have the quarantine period, but you will then undertake your local trust induction, and we run a 3-week OSCE training program. I'm currently sat in the building where we're doing it. We try to get you on that training program as soon as possible, so you may end up doing induction 1 week and then straight onto your OSCE training. and your exam booked within a month of you attending that training, fingers crossed, pass first time, get your PIN number, off we go. Some people obviously require a second attempt, and we support you with that as well as we go. And then we will also see you when you're in the clinical environment to work alongside you with the rest of the practice education team. And that's where we start to help you in passing your probationary period preceptorship on to progressing your career at the RD&E. So we want you to progress when you're here as well. We've got the practice education team, that's my team. So we help with a welcome to the RD&E hospital, give you some basics and facts, offer ward-based support, work alongside you as well as the OSCE. We have got a structured supernumerary period, and the reason I say that's bespoke to you is because some of you will need 2 weeks, some of you will need 2 months. We will do that, cross that bridge as we come to it. You've got your clinical nurse managers, sometimes called sisters, matrons. Different hospitals have different terms, but these are the nurses in charge of the clinical area. Then we have mentors and buddies that you'll be working with. Various networks available to you, freedom to speak up guardians should you wish to speak to somebody and you felt uncomfortable to do that on the wards, and our standard human resources occupational health, alongside that supportive 6 to 12 month preceptorship program, which really helps you to embed in nursing in the UK. I've been told that these are a few of the questions that people normally like to know before you come here. So we do have hospital accommodation. Yeah, it is basic, but the people in there are friendly. We do have Wi-Fi now. Once you've passed your OSCEs, of course, we do like you to look for your own rental property, or if you are lucky enough to be able to, purchasing a home. Average cost is around £300 for a room in a shared house. But if you're looking at renting on your own, or if your family is such are coming over, you could be looking between £640 and £800 a month. And then you've got your cost of utilities on top of that, council tax, and don't forget your food, transport, clothing and everything again on top. So it's costly, but the wages reflect that. So, you know, if you are sensible, you can have a comfortable work-life balance with your finances. And when you're established, also, you can pick up additional shifts and hours for that money. Variety of international food shops, but of course, you've got to get into the English pasties and Devon cream tea. I think it's a must. And we even have a presentation on that for your OSCEs, just in case. So you know what goes first, jam or cream. That's a very, very serious question. You will need to know that before you come here.
If so important. It's a personality test, isn't it?
Definitely. Some people may fail their OSCE if they do it wrong.
But not really, that's just a joke.
Or don't tell Tim that, he takes it very seriously. If you're planning on joining your family when you come here, that's fantastic. Obviously, really pleased that people are coming here. If you're looking at bringing family over once you're established, again, fantastic news. And sometimes you're able to support with recruitment of family and loved ones as well, if they wanted to work in the health sector. So, you know, please let us know if that's the case. We might be able to help you with it. Oh, just some pretty pictures. Here's my ward-based team. And then there's your exciting OSCE team. People passing, it's all exciting. We still have 100% success rate. I don't want to jinx us, but that's not bad with training over 350 people. When you come here, you will likely be allocated to a surgical or medical ward. You possibly have experience of paediatrics, oncology, theatres, but from a vacancy point of view, and the reason we are recruiting from overseas and increasing our student nurse numbers are the medical and surgical wards are the areas where they have the highest vacancies. So we will bring you into those areas where we have a patient staff ratio of 1 to 6 up to 1 to 12 in some areas with a lower dependency. And that's where you will likely start your career with us at the beginning, get the basics done in a ward environment. Of course, there is then the opportunity to move wards and departments, join the staff bank for extra money. Once you've completed your probationary period and preceptorship programme, we'll have bespoke conversations with you to say, what do you want to do? where do you want to work? And if possible, we will try to facilitate those moves, either through helping you with an interview and full recruitment process, or maybe as an internal move within the trust based on your skills and experience without having to interview. But we can work with you on those things. Vacancies that come up in areas such as oncology, neonatal unit, the emergency department, at any point you are welcome to go for vacancies that are in those areas, and we are happy to support you with your applications and to give you interview advice for you to work in those areas. But I'll be realistic with you, for when you come over, it will likely be a surgical or medical ward. We don't currently allocate our adult nurses into paediatrics, but I'm currently working on a program with our paediatric services where anybody that does have experience of looking after children that wants to gain their NMC PIN in for the child branch, we will help them with a conversion program to go through the test of competence to gain their child branch PIN. So that's a work in progress, and we hope that will be successful for some, even of some of you guys, if you do have that experience. Just an example of what our working patterns tend to be. We try not to allocate people to 3 long days in a row or 4 or more nights, because it's just far too exhausting. It's hard work, nursing, as you well know. So we are trying to allocate no more than 2 at a time, nights around 3. And annual leave is booked on the rostering system. You'll start off with around 7 weeks. The longer you work for the NHS, the more annual leave you get, because you need it. Agenda for Change pay scales, I put on there the little website you can look at, but below is the little chart of the expected starting rates for a band 5, which is what we recruit people as newly qualified. You can see there that that's based on the number of years experience. If you have 12 years experience, it's up to you during the recruitment process to discuss that, to see whether or not you start on the basic rate or a higher rate. That is for you to discuss during recruitment. Okay, so we're not turning around saying it's blanket, no, you're new, you're on the bottom. If your experience dictates, absolutely, we should be paying you your starting worth. Okay, so please be confident and have those conversations. We will not be offended. And every member of staff in our trust is valuable. That includes yourselves. We know that there are some areas that you may struggle with, such as writing the applications as we want to see them in the UK, and our interview processes. So we will be able to help anybody with that. But we want you to enjoy your job, so we will give you the educational support and opportunities to be able to do that. I've got multiple staff now on university modules at degree, master's level, where they're working towards their goals. If you want to go into a leadership role, we can offer you those modules. If you want to be an advanced clinical practitioner, again, we've got preceptorship programs and we can employ people. We have staff that have come to us, international candidates that are on those programs now, and it's brilliant to see because they are fab. There you go, short and sweet and a lot of talking.
Brilliant. Thanks, Jane. No, that's great. So a few questions that have come up in the chat. There's one question about accommodation. So obviously, as Devon, you know, we don't provide family accommodation for our international nurses, and we strongly recommend that the nurses come over, get their OSCE done, get their PIN, and then find family accommodation for them. And at that point, they can bring their families over. But someone has asked, do we provide any sort of assistance with that accommodation after the 2 months hospital accommodation?
Yes, we do. We found that obviously people have been struggling to know where to look. So what estate agent, how do I get the letter to say that I'm earning a wage? Yeah. Again, the practice education team and the facilitators that are on the ward are the ones that will be able to give you the web links that you need. So we don't do it for you, but we absolutely can signpost and make sure people know where to look, and buddy you up with somebody if there's someone else that's looking for a shared room as well as yourself, and you know, we can buddy up and see whether or not you would get along in that situation.
Brilliant, thank you. So the other question is, I don't know if you're able to quickly sort of whiz through the contents of the preceptorship course.
Right, no, absolutely. So the preceptorship itself, all trusts will run a preceptorship, so don't worry, that's not just something that's RD&E specific. Every trust will be able to tell you about their own. Ours in particular starts off looking at the absolute basics of risk assessments, the basic patient needs, and how do we as registered nurses take the responsibility for those patients, and what do we have to do to ensure that they're safe, bay management, enhancing some of our clinical skills. So for a lot of people, it will be what we call fast tracking. So signing a rapid document to enable you to continue the skills in the RD&E. If it's a skill you've never done before, the preceptorship identifies that and we can book you onto a full training program. As the preceptorship progresses, the skills become more advanced and it starts to bring into the leadership skills as well, so coordination. Mm-hmm. It's a handy document for us to be able to tick a few boxes to make sure that you're achieving in your probationary period to secure employment.
Yeah.
Okay, so it's probably like a skills passport you may have had as a student, to be honest.
Brilliant. And so a lot of those preceptorship sort of the sort of contents of it is all about that sort of, delegation, management, as they start to develop into maybe coordinating a shift.
Absolutely.
And what would be a sort of typical pathway? So for one of your international nurses that's passed their OSCE, they're on the preceptorship course, they've done the preceptorship course, what sort of opportunities might be following that in terms of sort of further development?
Absolutely. So for me, there is no typical pathway. We have a multitude of opportunities for anybody. Of course, you have to remember your visa requirements. You are coming here to work as a registered nurse. So you may find that there's a job opportunity that really piques your interest, but actually you don't have to be a nurse to do it. Unfortunately, within your first 5 years, you're not going to be able to do that on your visa. So you're going to have to look at what's there for the registered practitioner roles. But I've got Tella that's with me today that's teaching the OSCE program. She came through our OSCE program. So, you might find in 2 years' time, that's you. I've got people, as I said, on the advanced nurse practitioner role. So with you coming in as a band 5, within 5 years, you might end up as an 8A advanced practitioner on a ward. And why not if you've got the skills? I've got people coming over that are actually going to be in ITU, the emergency departments. You will be teaching our students and advanced practitioners of the future. So I don't want to turn around and say that this is your traditional pathway, because there are so many options to you all. And as we do with our own staff, you are our own staff. As we do with everybody, it is bespoke to you as to what you want as your career development. Some roles are more sought after than others, and it can take a little bit longer to get there. But if you want to be a nurse specialist, let's give you the best footing to get there. Let's give you the right modules funded with the university to help you. So it will be bespoke to you.
Lovely, brilliant. Thank you, Jane. And we've had another question come in from a Loretta. So just asking about career progression. I'm not clear the requirements to move up the bands, but again, there's no clear pathway for that either, is there? Because different bandings mean different things depending on what department you work in.
Absolutely. So if you're looking at a leadership role and wanting to enhance your banding through that, you'll be looking at the band 6s on the ward, which we call ward sisters. Other places will call a junior sister, I believe. And they are the staff that will take a small subsection of line management responsibility, some additional auditing and admin responsibility for the ward areas, looking at some of the human resources and having to do disciplinaries, as well as having interviews for career progression for others, all under the guidance of the band 7 on the ward. Obviously the next step up there would be that band 7, and then it would be onwards to the 8A, which is our senior matron, which oversees a couple of different ward areas. So that's what I would call a traditional leadership career progression. But if you're looking at advancing your skills and knowledge, of course you can go into a more advanced practitioner role, a nurse specialist, for example, or indeed you can come and keep me company in the education department and provide the education and support for other international candidates and newly qualified staff. So there are different ways that you can enhance your career, and most of you have already got a head start with your level of academia is what we expect in the NHS to be degree level, so you're starting off on a good footing, and we're able to, as I say, point you in the right direction for the advancement.
Yeah, that's brilliant. And we mentioned earlier that in terms of OSCE, you're a little bit of a headquarters for OSCE training in Devon, or no, not all the providers, but so for international nurses that are going to North Devon, Torbay, and the Ardini, they will all come through your team and have the OSCE training, won't they?
Oh, absolutely. So nobody gets to escape me completely. We do attack everybody, but it's very useful because, of course, then you've got a large group of people undertaking the training. So you've got people that you can practice with and talk to, rather than just a small group and being left on your own to try and learn it. So it's quite nice to have a few people coming through at once.
Brilliant. That's fantastic. Great. So Laura, have I missed any questions?
Not that I can see. Let me just cast my eye back again. So just the last question was, I think Tracy is already answering, but no, just to say, lovely presentation. So no, nothing else really.
That's brilliant.
Well, thank you ever so much, and hopefully see some of you in the future.
Thank you,
Jane.
Thanks, Jane. And a big thank you to both Jane and Tracy today for coming along and talking about Torbay and South Devon and the Royal Devon and Exeter. And someone's just said in the chat, this has been a real eye-opening webinar on what I should expect. So that's just fantastic. And obviously, you know, we do put our videos onto our YouTube channel, which is Nursing in Devon. And I think Laura's put the links in the group chat so people can catch up on this if they don't see it now. But huge thank you. So as I mentioned a couple of weeks ago, so our webinars are now fortnightly. So our next webinar will be the beginning of December. Can you believe it? And that will be our recruitment focus webinar. So we're just in the process at the moment of arranging some little online Christmas parties for our new arrivals. So we're going to have quite a few nurses arrive in December, and we're going to have some games, some quizzes and some fun with them. But yeah, so thank you everyone for joining us today. Great expert speakers. And obviously email us. The email is in the group chat, and we look forward to seeing you all in a couple of weeks. Stay safe, everybody. Bye.
Thank you very much.
Bye.
Bye.
Bye. Bye.